Refer 247 Natural Health Tricks. Come for details what kidney patients need to do to keep their hearts healthy. People with kidney disease or kidney failure are at risk for heart disease. In fact, it is very common. These 10 tips can help kidney patients reduce their risk of heart disease, or help prevent heart disease from getting worse. Tip 1. Kidney patients need to reduce high cholesterol levels. Make sure you have an annual blood test for the following. Total cholesterol. Low-density lipoprotein (LDL) bad cholesterol. High-density lipoprotein (HDL) good cholesterol. Triglycerides. Ask your healthcare provider about your cholesterol goals. When your level is not in a healthy range, you should follow a low-fat diet. Increase physical activity. Ask about a medication to help lower cholesterol, if needed. Tip 2. Kidney patients need to control high blood pressure. When you have high blood pressure, take all your blood pressure medicines as instructed. Some medicines called angiotensin-converting enzyme inhibitors and angiotensin receptor blockers help to protect your kidneys and heart. Above all, ask your healthcare provider about these if you do not take them now. Ask your healthcare team what your blood pressure reading should be. For many people, it should be less than 140/90ths before your treatment and less than 130/80ths after it. Follow your fluid and sodium, salt, limits to keep extra fluid from building up. Your diet should not include more than 2,000 milligrams of sodium daily, or 5 grams of salt a day. Better yet, speak to your dietitian once a month. Kidney patients, during dialysis should consult your dialysis care team if the following steps can help prevent fluid buildup. Increasing fluid removal during dialysis. Ultrafiltration. Longer or more frequent dialysis treatments. Tip 3. Control blood sugar if you have diabetes. Check your blood sugar level as often as your healthcare provider recommends. Also, follow your treatment plan of medications, diet, and exercise. Above all, ask your healthcare provider about which diabetes medications are best for you. Some medicines may be better than others when you are on dialysis. Kidney patients need to be very careful. Tip 4. Kidney patients need treatment for anemia. Most people with kidney disease or kidney failure will have anemia. Anemia means your body doesn't have enough healthy red blood cells. Anemia can be treated with a medication called ESAs, erythropoietin stimulant, and extra iron. Of course, they will help your body make red blood cells. So treating anemia can help prevent heart disease. Because when you have heart disease, it helps prevent it from getting worse. When fixing anemia, it helps keep the heart muscle from thickening. Because if this muscle becomes thick, it will be harder for the heart to pump blood. Tip 5. Talk to your healthcare provider about taking aspirin to prevent heart attacks. Certainly, your healthcare provider may recommend a low-dose aspirin to help prevent heart attacks. Your healthcare provider will need to make sure aspirin does not cause you to have bleeding problems. Tip 6. Keep calcium and phosphorus in balance. Calcium and phosphorus are important nutrients that your body needs. But most people on dialysis develop calcium and phosphorus imbalance. This can lead to bone and heart disease. So, keep these two important minerals in balance by following a low phosphorus diet, taking medicines called phosphate binders with your meals and snacks, taking an active form of vitamin D if prescribed by your healthcare provider. Tip 7. Kidney patients need to follow a heart-healthy diet. Eat foods low in saturated fats and cholesterol. Limit high-phosphorus foods like dairy, nuts, seeds, dried beans and peas, and dark sodas. Increase foods that are high in heart-healthy omega-3 fatty acids, such as salmon, flax seeds, soybeans, walnuts, and canola oil. In particular, speak to your dietitian about how to get the right amount of protein and calories to stay at a healthy weight. If you are obese, please refer to News, Weight Loss on the website to find the weight loss formula that is right for you. Tip 8. Increase physical activity. Ask your healthcare provider if you need physical therapy first to improve your strength and endurance before increasing physical activity. Start exercising slowly and build gradually to about 30 minutes most days of the week. Exercise regularly to help improve unhealthy cholesterol levels. Reduce excess weight. Control blood sugar and blood pressure. Improve heart and lung fitness. Tip 9. Renal patients need to stop smoking. Smoking increases your risk for heart and blood vessel disease. If you smoke, ask your healthcare provider to refer you to a program to help you quit. Tip 10. Kidney patients reduce stress. Stressful feelings like sadness, anger, and worry may contribute to heart disease. Your social worker can help you learn how to cope with stressful feelings and should speak with you when you start dialysis and at regular intervals after that. Also, psychological counseling and medications may also be recommended. In particular, develop yourself to become what you want with your own interests. Refer to skills development on the web to reduce depression and love life. Good health. Thank you for watching.